This is the Ohio Adult Allies Podcast. Welcome. Here, our mission is to develop, inspire, and empower youth leaders. Our topic for today is innovative approaches to addressing the social determinants of adolescent health, with special guest, Dr. Kathleen Tebb. Now here's our host, Shawn Jeffers.
Well, welcome to the Ohio Adult Allies podcast series. My name is Shawn Jeffers, and I am with Youth at the Center in Cincinnati, Ohio. And it is my pleasure today to have Dr. Kathleen Tebb with us today. And we're going to be discussing innovative approaches to addressing social determinants of adolescent health. So, Kathleen, will you take a few seconds to introduce yourself?
Absolutely, Shawn. Thank you so much for having me. I really appreciate it. And more than that, I appreciate the attention that you're giving this issue in Ohio. So just for background, I'm a professor in the Division of Adolescent and Young Adult Medicine at the University of California, San Francisco. By training, I'm a developmental psychologist and a health research psychologist. And I've done a number of studies, and my area of expertise is really around understanding adolescent risk behaviors and developing and evaluating interventions at a variety of levels, the individual, family, community, schools, and the policy levels to really promote health. So with that, there's clearly a strong relationship with social determinants of health. And I've conducted a number of studies to understand and identify strategies around social determinants of health and their influence on adolescents.
Thank you so much for joining us today. And so as we're exploring some innovative approaches, we just want to start really at the ground floor and just say, can you give us your working definition of social determinants of adolescent health, how you think about it?
Yeah, so most of you know, and I think are really familiar with social determinants of health. And I really conceptualize them as the upstream factors, the structural, the socio-ecological factors that influence health outcomes. I like the World Health Organization's definition, which simply states they're the conditions in which people are born, grow, work, and live.
Well, thank you. So I think one of the things we want to look at, we're going to look both about how this might, social determinants of adolescent health, how they might impact different populations of young people, and also what might be going on geographically around the country and around the world as we go through this podcast series. And so I think that first piece we do want to get to, we know one of the things that's come up as we've done more research into looking around, such as like childhood ACEs, adverse childhood experiences, things of that sort, is that the initial study largely was, like a white upper to middle class, kind of population. And so some of different voices or, diverse voices were maybe left out of that conversation. So if we're thinking about looking at social determinants of adolescent health, is there things going on right now, particularly when we're thinking about, potentially vulnerable populations, such as our young people of color, our LGBTQ plus population, that we should really have on our radar?
Thank you, Shawn, and especially for your attention to special populations and populations that face some added challenges. I think when we think about social determinants of health, the impacts are really much more profound and explain some of the variations we see in outcomes when we're thinking about diverse populations or populations of color or LGBTQ youth. Adolescents who are non-white, from immigrant families, LGBTQ youth, those in foster care or the juvenile justice system, homeless youth, they really face some of the most persistent and unacceptable health disparities. And these disparities stem from social determinants of health. So it's absolutely critical that we turn our attention to these factors that affect these special populations if we truly want to provide equitable access to quality of life, health, economic, and educational attainment.
And can I ask a follow-up question just around that? Is I think, right, like sometimes we know when we think about looking at systems or structural things, like policies or practices were created with a certain group in mind. And so when you're a young person that's entering spaces and you can see, that the space wasn't made with me in mind. And I think young people are keenly aware of like spaces they go into that seem very adult oriented or adult focused. But just even beyond that, like some of our, as you said, special populations, that sometimes just feel like they're in spaces that just don't seem welcoming to them. Like, is there something we can have, just in a practical sense, being able to do to support young people in their development in those spaces, that we can make them feel more youth centered?
Absolutely. So I'm going to take take that question in two sort of different approaches. I think one is more of this macro level, and I think when we think about these structural determinants of health, that these structures are set up with social, health, economic, and political contexts that create divisions that lead to differences in status and power, privilege, and access to information and resources. So I think it's important to think about um, those structural issues at the macro level, and then break it down into thinking of how can we think about tackling some of these to make more safe and supportive environments for young people, to get back to the more practicality of your question.
Yeah.
And I think one of the first things to do is, as adults, we don't always know what's best for young people. And so engaging young people in the shared decision making process and empowering them um, to analyze their environments and consider recommendations to their environments, and planning strategies to make those environments more safe and supportive and accessible is absolutely critical and essential. And figuring out ways to meet youth where they're at. Sometimes vulnerable populations don't feel comfortable accessing traditional healthcare systems because of structural racism and implicit and unconscious biases.
So, Kathleen, are there any innovative approaches you're aware of in the area of mental health?
Oh, I'm so glad you asked that question. Thank you, Shawn. My colleague Peter Mayfield in rural Northern California created a program called Whole Hearts, Minds, and Bodies. It's a nature-based therapeutic mentoring program. And so in this model, paraprofessionals from the community are recruited, trained, supported, and supervised by licensed psychologists to address mental health issues of youth with really severe mental health issues. So, in doing so, this model builds jobs in the capacity of the mental health workforce. And then, in taking youth out of the clinic and into nature, it also destigmatizes mental health care services that are often a barrier for youth from different cultural backgrounds. And this program has demonstrated high youth engagement in the program, especially among Latinx youth. And so, really, when we think about successful models and successful models of mental health, they can really improve not only just the individual outcomes, but they can reduce rates of delinquency, incarceration, and healthcare costs. So I think that's a really critical component.
Thank you. I love that approach because then sometimes, while hospitals or sterile, settings might be clean or hygienic, they don't always support our, mental and emotional support, social really health. That, like, 'cause sometimes we lose personality, we lose relationships and connections. So I love this idea of sometimes getting people out to nature, getting people out where they can connect with others and not be in, kind of limited environments is awesome.
Yeah, and often county mental health services are co-located with other services that can be sort of re-traumatizing if they're co-located in the juvenile justice system or the child protective systems. By just even going to those facilities, it can reintroduce some, or bring back some previous trauma for these young people.
Yeah. Great point. So as we start to think about, things that are going on, like, are there innovative approaches that you encountered, or just even how might approaches just even vary as we're thinking about what's going on, either, regional or, local, national, it's just at different levels as we're thinking about doing this for scale. Because I think sometimes, right, when we work with young people, our young people see that there's an issue and they want to seek out and solve this issue all across the world. And we're like, sometimes we have to start small and, and work in our school or our neighborhood, and then we can go out. But just seeing if you've seen any really, exciting approaches or ways people have tried to address things either local, regional, or national?
Well, I have to say this is really exciting because social determinants of health has gained some traction. It's not a new concept. It's been around for a very long time, but it has gained traction, and we are starting to see a number of innovative approaches both within the US and globally. I published an article a few years back in the Journal of Health Equity, which showcased a number of innovative programs across the US. And since then, we've been able to continue to add on that list. So I think one of the things I'd like to highlight, a common feature across many of these innovative approaches is that they involve cross-sector collaboration to break down traditional silos between health, education, and social services. Um, so there are a number of community-based initiatives that have been focused on implementing coordinated strategies across different sectors in neighborhoods. So for instance, in Harlem, the Children's Zone focuses on children within 100 block. You're familiar with it, I see. um, area that had chronic diseases and infant mortality rates that really exceeded rates for many other sections in the city. They also have high rates of poverty and unemployment. So they're working to improve educational, economic, and health outcomes of the community through a really broad range of family-based social services and health programs. So that's one example in Harlem. We've seen things in Texas and in Los Angeles and um, all over the place. So, I'd be happy to share some more examples if you'd like.
Yeah, if you could share a couple more, that would be fantastic.
Sure, sure. So, another program that I'm really excited about and I work closely with is through the Los Angeles Trust for Children's Health. They partnered with the Los Angeles Unified School District, which is the second largest school district in the nation, to develop wellness centers, which are really comprehensive um, school-based health centers that are either on or co-located at school campuses. So they currently have 19 wellness centers at middle and high school campuses in the greatest needed areas of the community. And they bring together community clinics, mental health providers, schools, advocacy groups, and community partners to tackle collaboratively urgent issues that are affecting the lives of young people. And what's really terrific about this approach is that each of the wellness centers has their own youth advisory board. And then there's a youth advisory board that covers across all of the wellness centers. So there's this really beautiful structure where you have even in the regional level, you have local youth advisory boards that are providing input and insights and guidance on the look and feel and the design of the wellness center, conducting outreach opportunities for other youth in the schools, and building the capacity of those young people to be agents of change.
That's fantastic. In Cincinnati, we have a similar kind of program. And I'll just share, like, I think it's the importance sometimes of knowing about the communities we're trying to impact, because there's a few communities where people, largely stay in those communities and they don't leave those neighborhoods. And so one of the things that happened is a few years ago, Cincinnati Public Schools tried to move, combine a couple high schools. And it was like a lot of the students from this neighborhood just dropped out. And then so they had to reestablish the high school, and they also put in a health clinic. So it now has an eyeglass center and a dentist and a doctor and mental health and all these things, because they're like, if students aren't going out of the neighborhood, how do we bring the services to them? And I think so often we're used to people just coming to us. And I think like that really important aspect is we're thinking about addressing social determinants of adolescent health or just systemic issues. Like, how do we make the system work for individuals and not just continue to force people to navigate sometimes difficult, systems or structures? So I appreciate you sharing that example. And so just,
Well, Shawn, I couldn't have said that better myself.
well, thank you. And so, yeah, so I appreciate you sharing it. Has there been anything internationally or global that you've seen that have been innovative approaches in other countries that we can learn from as we're trying to better serve and support young people's development?
Yeah. Before we move internationally, I do want to just mention real quickly also in the United States, we've also seen as you're thinking about these school-based clinics or other types of partnerships,
Yeah.
We've seen a number of initiatives where there's been investments in innovative programs, and we're still kind of waiting for some of the outcomes to see how providers can provide prescriptions
Mhm.
for community members to either go to the park. Nushin Razani at the UCSF Center for Nature and Health had a wonderful study that showed that by providing families with prescriptions to just open space parks, reduced significantly reduced stress symptoms. Another program offered offered prescriptions for housing, which really fast tracked low income families who are eligible for public housing to actually get those services. So I think there's the local level that we talked about,
Mhm.
with these sort of community school-based health and wellness centers that are really holistic in nature and engage young people. But there's approaches at many levels that we can tackle. So I wanted to bring that. But internationally, I think there's some really exciting approaches as well. um, so, for instance, in India, the Ministry of Petroleum and Natural Gas, they actually launched a program to provide poor and vulnerable households with clean fuel for cooking. And this really changed the prevalence rates of asthma. These households, prior to this program, were using primarily firewood, kerosene, and other fuels that are really harmful to human health. And so this is just like one approach how, thinking about a completely different sector that us in the health industry rarely would collaborate with, took this different lens and brought it to a level that addressed asthma, which not only reduced the prevalence, but reduced healthcare costs. And I think there's a number of exciting approaches. So, in neighborhood settings worldwide, we've seen a number of approaches where health equity includes community gardens, which promote physical health and mental health, community cohesion. Canada has a number of these, and they have a number of programs for Indigenous communities, which I think is really exciting to think about. So, um, using the foods and the cultural practices to promote health, talking about, our own, bringing in our own cultural
Yeah.
humility and learning from those indigenous populations. Um, Health equity in schools has particularly been addressed through nutrition initiatives globally. School breakfast and meal programs have proven to be effective in the UK and in Australia from children from low socioeconomic and indigenous backgrounds. And again, it's not just the nutrition, it improves physical health and mental health, student concentration, their ability to attend school, and then their relationships between the students and the staff. So tackling some of these social determinants of health, whether they be, in the homes, the neighborhoods, or the schools, all of these different areas are potentials for opportunities for change.
And I'll just say, as a host of today's podcast episode, is that while I may not be a licensed individual to offer such a prescription, we encourage you, adult ally friends who are out there listening to this, to hopefully take this on, take this podcast outside. Take yourself on a walk, take your dog on a walk, or your kids, and get outside and listen and learn. And so I love that idea of just being able to kind of make time, because sometimes we measure how busy we are and not, how much we're sustaining ourselves in doing this incredibly important work. So awesome. So as we come towards the end of our conversation today, there's a question we ask sometimes when we're working and dreaming about possibilities, where we say, if time and money was no option, like what's the one thing you would want to see changed? And so I would ask maybe a little bit of just, if time and money was no option, Kathleen, when we're thinking about social determinants of adolescent health, or the way we engage or support our young people, is there something if you had the power, you just snap your fingers and it would happen? What's that one thing you'd love to see changed in our society?
Well, I wish I had a magic wand, and I wish there was just one thing that we could change. But one of the things that I like to say is there is plenty of room in the sandbox for everybody to tackle these kinds of issues. And so rather than one, I would like to say that there are more like 5 main categories. I knew you weren't gonna
Lots of
like that,
hyphen, lots of
but I can't help myself. And I think it really speaks to the fact that we do need to have these cross-sector collaborations. And so if you want to put it under one, I think that would be the one global category. But the first is really education, which begins with early childhood and extends through college and vocational training. Adolescents who don't attain high school on average live 6 to 9 years less than those who do graduate from high school. So this is really critical. The second is safe and equitable employment practices. The availability of good jobs that pay a living wage and offer adequate hours, include benefits such as health and sick leave and paid time off. I mean, that's absolutely critical. Um, the third involves social justice reforms from policing to courts. Policing and systemic racism are a public health crisis. The police use of force in the United States is the sixth leading cause of death for Black men, and that's just the tip of the iceberg. Practices have a wide-reaching mental health and other adverse impacts that disproportionately affect people of color. So the American Public Health Association has developed a number of policy recommendations to increase public safety, especially for people of color, by addressing social determinants. So that's just the third one. The fourth is living environments that impact our communities, neighborhoods, housing, and really access to basic needs of clean air and fresh water, healthy foods, and safe environments. We see this in our rural communities as well as our urban environments. And the fifth area is access to affordable, comprehensive, and quality healthcare. But as I mentioned earlier, this also really involves that cross-sector collaboration to reach beyond clinical walls. So within these 5 domains, there are policies and actions that can take place at the national, the regional, and the local level.
Thank you. That's a fantastic list. If we could get to work on that, that'd be great. And for any adult ally who's listening, and done a strategic planning process with their young people, sometimes the inability to narrow down to just one issue has been a stumbling block for all of us in doing our work, because there's so much that we want to do and impact. And so I think this is, we recognize that. And so that'll be the last question we just have. Is there, if there's an adult ally who's listening to this and thinking about, is there one thing I could start to do more in my practice when I'm engaging young people about how we could start to be more cognizant of social determinants of adolescent health, just more aware, more responsive? What might be that one thing you'd encourage people to start with?
Start small, listen to the young people, think about your communities, think about the low-hanging fruit in terms of what's feasible, realistic, and attainable to achieve. And it's really quite remarkable how when you start small with such intentionality, how things can kind of snowball and become much bigger and bigger. And as you're doing it, hold on to hope. Don't lose hope. Adolescents and communities are resilient. These issues are hard. They're painful. But we do have the ability to ameliorate some of these negative experiences. And just continue to advocate and work for change. I think it takes passion, perseverance, and a whole lot of grit. Um, so,
Well, thank you, Kathleen. As you were sharing your closing remarks, it was reminding me of the lawyer, Brian Stevenson, who kind of talks about get proximate to the issues we're trying to address and maintain hope, sometimes in the face of, impossible odds. And I think if we can do those two things, I think we can really start to at least move in the direction where we can support our young people. So thank you so much for joining. Again, my name is Shawn Jeffers. I've had the pleasure of enjoying this conversation with Dr. Kathleen Tebb. And this has been a conversation about innovative approaches in social determinants of adolescent health. And hope you've enjoyed this conversation, and we'll check out other podcasts that we have at Ohio Adult Allies website. Thank you.
Thank you to our special guests. For more information about their organizations, feel free to use the information on screen or below in the description. Thank you to our listeners. This has been the Ohio Adult Allies Podcast. For more episodes, you can find us on Spotify, iTunes, Google Play, YouTube, and more. You can also find our episodes and more information about us on our website, ohioadultallies.com.